Columbus, Ohio. Ohio's 1,002 known coronavirus-related deaths are spread across 60 of the state's 88 counties, with total cases now reaching 18,743, the Ohio Department of Health reported Friday.
The reported deaths increased 2.8% from 975 the day before, while the case total was up 4% from 18,027.
Separately, data from the Ohio Hospital Association said there were 1,066 patients in reporting hospitals across the state. This number has been fairly steady at around 1,000 for more than a week. The number of patients in intensive care was reported at 418, continuing a gradual decline over several days.
Related story, cases per capita 3 times higher in Ohio's large urban counties than the many counties under 50,000.
The state's case total has gone up daily by 716, 724, 534, 444, 362, 376 and 418 over the last week. Higher increases earlier this month were tied heavily to stepped-up testing in prisons, even among inmates without symptoms.
The prison department later Friday reported 4,649 cases, 4,034 inmates and 615 staff. This was up from 4,517 on Thursday, 3,925 inmates and 592 staff, and well above 489 inmates and 184 staff on April 16 before the extensive testing.
Affecting comparisons to earlier trends, the state on April 10 began new reporting standards to include more types of testing and cases identified from non-testing evidence. This has resulted in 781 probable cases being included in the total.
Thursday marked the 10th consecutive day of case increases of 2% to 4%. In March the daily increases were often above 20%, and sometimes above 40%.
Dr. Amy Acton, the state's health director, has said Ohio has largely plateaued, though she also has said many more people likely have been infected than reported.
Governor Mike DeWine said Ohio is significantly increasing testing capacity. More testing is viewed key to containing the spread of the virus, but it will also cause the number of reported cases to go up.
A total of 139,725 tests have been conducted, an increase of 6,577 in the last day, the state reported. By comparison, the state reported 4,270 additional tests last Friday.
Ohio, unlike some other states, does not provide information on the number of current cases remaining, excluding those who no longer have coronavirus, saying that information is not available.
Yet health officials have said coronavirus often runs its course in 14 days, longer for the most severe cases, indicating that many known cases no longer exist. Most of the known cases are older.
Among the cases reported to date, excluding those who have died, 6,065 have had an onset in the last 2 weeks. A larger share of the cases, 11,676, are older.
The age range for confirmed cases to date is from under 1 to 106, with a median age of 51.
Just over half of all deaths, 507 of 1,002, or 50.6%, have been to people age 80 and over. This age group accounted for 44% of the deaths nationally in 2017.
About half of Ohioans are under 40, yet only 6 people in this age group are known to have died from coronavirus, 5 in their 30s and 1 in their 20s.
The counties with the most deaths are Lucas, 119, Cuyahoga, 115, and Mahoning, 82.
Among all cases reported to date, 3,634 have been hospitalized, including 1,056 in intensive care units. These totals were 3,533 and 1,035 on Thursday, 3,421 and 1,014 on Wednesday, and 3,340 and 1,004 on Tuesday.
The counties with the most cases are Franklin, 2,589, Marion, 2,276, Cuyahoga, 2,217, and Pickaway, 1,731. Franklin, Columbus, and Cuyahoga, Cleveland, are Ohio's 2 most populated counties. Marion and Pickaway have high numbers of prisoners with COVID-19, as do Franklin and Belmont to a lesser extent.
For the deaths in which race was reported, 79.8% are white, and 17.7% are black. Yet for total cases, 59.1% are white and 28.8% black. Ohio's population is 81.9% white and 13% black, census estimates say.
The statewide total of cases was 15,169 a week ago.
The first 3 cases were confirmed on March 9. The total topped 100 on March 19, exceeded 1,000 for the first time on March 27, and went over 10,000 on April 18.
Corrections in the data are made from day to day by the state. Sometimes the state has reduced the number of cases in individual counties from one day to the next as corrected residency information is received.
The chart below is based on the most recent case data from the Ohio Department of Health. Cleveland.com calculated the cases per 100,000 rates based on 2019 census population estimates.
Note to readers, this daily summary from Cleveland.com will now be posted only each weekday, no longer on weekends. Check this link for the next analysis on Monday.
Rich Exner, data analysis editor for Cleveland.com, writes about numbers on a variety of topics. Follow on Twitter at Rich Exner. See other data-related stories at cleveland.com/datacentral.
Read related coverage.
See coronavirus cases by day for each Ohio county.
2,095 from these Ohio nursing homes have coronavirus, state reports.
Why Ohio widened criteria for counting coronavirus cases, what other states are doing, and the difference in numbers.